When choosing a health plan, in almost every case, you'll find that your health plan costs differ between visiting an urgent care center or an emergency room. In the right circumstances, choosing an urgent care center will save you and your health plan a fair amount of money. But in some scenarios, an emergency room will always be your best choice. Let's look at a couple examples. Let's say your child is playing basketball with some friends and lands on their ankle wrong. It's 7 p.m. in the evening, your child is distraught with pain, and their ankle is swollen. Many urgent care centers are open until 8 or 9 p.m. or sometimes even later. And most urgent care centers are able to provide you with care, whether it is a broken or a sprained ankle. In addition, your waiting time is usually less at urgent care centers. To top it off, your total bill is almost always considerably less than an emergency room visit. Other urgent care examples would be for minor cuts, minor burns, as well as throat aches, earaches, and respiratory infections. Of course, in the examples where it is not mandatory that you meet at a physician's office and you have the option of a video or a phone appointment with a doctor, then by all means take advantage of that option, which is usually the least expensive option of all. Here's a different example. Let's say you or a family member experiences something life-threatening. This would be a perfect example of a reason to go directly to the emergency room. If you are not far from the emergency room and someone can safely drive you, then that can be a good option. If not, then using an ambulance may be your quickest way to receive care. Yes, this will almost always be more expensive, but emergency rooms are better equipped to deal with life-threatening conditions than urgent care centers. For additional questions or to review your health insurance with a professional, call Bender Insurance Solutions at 888-738-6346 or email us at memberservices@mybendersolutions.com.